So today we're going to talk about postpartum depression. Now, postpartum depression is a mood disorder that can affect women after childbirth. Mothers with postpartum depression experience feelings of extreme sadness, anxiety, and exhaustion that may be difficult for them to complete daily care activities for themselves and for others. Postpartum depression does not have a single cause, but likely results from a combination of physical and emotional factors. It's important to note that it does not occur because of something a mother does or does not do. Postpartum depression can occur due to levels of hormones such as estrogen and progesterone in a woman's body quickly dropping. This can lead to chemical changes in the brain that may trigger mood swings during this time. In addition, many mothers are unable to get the rest they need to fully recover from giving birth. Situations such as constant sleep deprivation can often lead to physical discomfort and exhaustion, which can contribute to symptoms of postpartum depression. While the mother is often the individual being screened for postpartum depression, it is also something that a father may have to deal with as well. This could be attributed to the change of life stresses that occur with a new child. Postpartum depression is not uncommon in pregnancies, with 1 out of every 9 mothers being affected by some form of it. While it's becoming increasingly more difficult for healthcare providers to detect postpartum depression due to the push to shorten the hospital stays, it is important for the nurse to know the signs and symptoms to provide patient education for what to watch out for.
All right, so I'm going to go over the importance of screening and prevention and identifying risk factors. So when postpartum depression is identified early, it is highly treatable, but without screening, postpartum depression can easily go unidentified and untreated. Although there are no national guidelines for depression screening, during pregnancy and in the postpartum period, women should be screened before leaving the hospital after giving birth, and an extremely important time to do a screening is during a follow-up visit around 4 weeks postpartum. So the American Academy of Pediatrics recommends maternal depression screening at the infant's 1 month, 2 month, and 4 month visits. Another important thing to remember when screening for postpartum depression is to assess family members about the maternal behavior to get a better aspect of the mother's mood and situation. So at these follow-up visits, there are a few different self-assessments that nurses can use as tools to determine the mother's risk for postpartum depression. These tools are the Edinburgh Postnatal Depression Scale, the Postpartum Depression Screening Scale, and the Postpartum Depression Predictors Inventory. So the Edinburgh Postnatal Depression Scale is the most common, and it is a self-reporting assessment designed specifically to identify women experiencing postpartum depression. So this is an example of the format that they use, and it's just about 10 questions that they ask about kind of common symptoms of depression, and the women respond to these questions of how they're feeling, and that is used to assess if they are at high risk for postpartum depression. And then anyone who has a baby is at risk for postpartum depression, but there are risk factors that increase the likelihood of women to experience postpartum depression after the birth of a child. Some of these risk factors are history of depression and anxiety, postpartum depression with a previous birth, emotional distress during labor, and breastfeeding for less than 6 months. And this has to do with the hormones involved with and released when breastfeeding, as well as bonding with the baby. Also, twins or multiple births increase the likelihood of postpartum depression. A weak support system or relationship problems with a spouse or significant other can increase the risk factors, and then also an unplanned or unwanted pregnancy. So it is important as a nurse or a healthcare provider to ask the right questions, continue asking them, and help the patient to get treatment. no sign is too small to further investigate.
Okay, so I'm going to talk about some signs and symptoms of postpartum depression. Okay, there are 3 types of postpartum depression. You have baby blues, which occurs right after birth and lasts a few days up to 2 weeks. Postpartum depression, which is more serious and longer lasting. And postpartum psychosis, which is rare and sometimes the symptoms are more severe. So with baby blue postpartum depression, you'll have mood swings, anxiety, sadness, irritability, feeling overwhelmed, crying, reduced concentration, appetite problems, and trouble sleeping. With postpartum depression, the symptoms are more serious and they are longer lasting. The mother can feel depressed or in a severe mood swing, excessive crying, insomnia, or sleeping too much, reduced appetite or eating too much, reduced pleasure and interest in activities she used to enjoy, withdrawal from family and friends, intense irritability and anger, fear of not being a good mother, hopelessness, feeling of worthlessness, shame, guilt, inadequate. She'll have diminished ability to think clearly. Also, thoughts of harming herself or the baby is something to look for. If these symptoms go unnoticed or untreated, severe depression can lead on to other health issues. So it's also important to let the mother know that this is not a character flaw or a weakness. And a rare condition, which is postpartum psychosis, the signs and symptoms are more severe than postpartum depression. You'll have confusion, disorientation, obsessed thoughts about harming the baby or harming yourself, hallucination, delusion, sleep disturbances, excessive anger and agitation, paranoia. And then last but not least, we should not forget about the fathers who can develop postpartum depression as well. They have a feeling of sadness and fatigue. They become overwhelmed. Sleeping is usually disturbed and eating. Same signs and symptoms as the mother, and the treatment is also usually treated as the mother would be treated. And some of the risk factors for that depression, for postpartum depression in men, are younger parents, history of depression, relationship problems, and struggling with finances.
Hi, now we're going to talk about nursing interventions and treatment options. As a nurse, as Kylie said, assessing is one of your common use skills, and you can administer that Edinburgh postnatal depression scale to help with this assessment that you're doing, as well as observing for signs and symptoms that Jeannie just discussed. Another important nursing action is education. According to the Office of Women's Health, these things are important for moms and partners to know. It's important to teach the spouse and family the signs and symptoms of postpartum depression. They may be the first to recognize the symptoms in a new mother. They can encourage her to talk with her healthcare provider or offer emotional support and help with the baby, and assist with daily tasks around the house. Remind her of the importance to rest. She should sleep whenever the baby is sleeping. New moms need to manage overwhelm and try not to do too much or to do everything themselves. So she should ask her partner, family, friends for help. whether helping around the house or taking care of the baby when depression gets too bad or she needs a break. Teach the mother if she is feeling depressed during pregnancy or after having a baby to not suffer alone. She should talk about her feelings with her partner, supportive family members, and friends. And she should tell her care provider right away. Some mothers are helped by talking with other mothers so they can hear about other mothers' experiences. There are postpartum depression support groups as well as new mother support groups. And don't make any major life changes right after the birth. Major life changes in addition to a new baby can cause unneeded stress. And make time to go out, visit friends, spend time with your spouse alone, the things that the mother used to enjoy before becoming a mother. The National Institute of Mental Health discusses treatment options, such as counseling, therapy. These treatments involve talking one-to-one with a mental health professional. And the two types of counseling that have shown to be particularly helpful for postpartum depression are cognitive behavioral therapy, CBT, and that helps the mother recognize and change their negative thoughts and behaviors. And also interpersonal therapy, IPT, and that helps them understand and work through problematic personal relationships. Electroconvulsive therapy can be used in extreme cases, more for the postpartum psychosis. And antidepressants are one of the most commonly used. These medications can help relieve symptoms of depression, and some can be taken while you're breastfeeding. And there are natural practices in case people don't want to do medication. And it's more helpful with milder cases as well. Taking omega-3s can help with the brain chemistry. Taking care of your body by taking long walks with your baby in the carrier, or picking up healthy, wholesome food at the grocery store, and avoiding alcohol and drugs. In conclusion, reassure new mothers that their feelings aren't abnormal. Many mothers experience postpartum depression and postpartum blues. She should talk to her provider about the symptoms she is experiencing so they can formulate a plan to get her feeling better again. And to that end, here's a video compilation from celebrity moms who experience postpartum depression and want other moms to know that they are not alone. Help is out there and she can recover from this. So that's the end of our postpartum depression. Hopefully we taught you all the things you needed to know, and hopefully there's no questions since we can't answer them right now.
Thank you.
Terrible.